I've been playing music since I was little, and in my sort of late teens got more into it and ended up going to university to study music and, funnily enough, lighting design. I've always had an interest in psychology and I guess how human beings work, whether it's yoga, psychology, coaching, that sort of side of things. And then around the year 2000, just a friend of mine mentioned music therapy as a distinct healthcare profession, and she wondered whether I'd heard about it. And as soon as I didn't know it, but as soon as I spoke to her about it, it really seemed to connect to the love of music I had, as a child from 8 learning the piano. And then that interest in psychology and how we work on the inside. And I was living in Cardiff at the time, and there was a training course in Cardiff at that point in time, and I applied for that. It was a postgraduate diploma many years ago, and I think I qualified in something like 2002. So that was really my entry into the profession. You may be aware that music therapy, art therapy and drama therapy are all regulated by the Health and Care Professions Council. So they are, protected job titles in law, and there are now a whole number of universities and training providers that you have to go to in order to qualify and then register with the Health and Care Professions Council. So it's a very well regulated profession. We're part of the team of AHPs, so we work alongside and professionally we're on the same level as speech and language therapists, OTs, physios, radiographers. We're in that big group of professions that are at the heart of the NHS and clinical practice outside of the NHS. We work within the NHS. We also work with private healthcare providers, and then we do a lot of work through medical legal channels, so case managers and solicitors. And all of those require us to be part of MDTs, and obviously the medical legal stuff, we have to join MDTs, for the period of time that we're working on those cases. At Chroma, we are very collaborative as an organisation, so we will want to follow the MDT goals rather than create our own sort of music-centred goals. It's about, the psychological well-being of the patient or the client. It's about functional gains, with fine motor control or speech and language around, volume control, articulation, intelligibility. Those sort of things are the core MDT goals. What we find, and this is borne out both in clinical practice and the neuroscience around how music interacts with the brain, is that because music stimulates a really diverse range of brain areas and networks, music has an impact on speech and language. Music has an impact on the sensory motor system. It has an impact on cognitive function, and clearly on the psychological side, the emotional well-being of a client. So music is multidisciplinary in that sense. So for us, it's a very natural place to sit within the MDT, and we contribute to the thinking and the sort of expertise across those various disciplines. So physio, neuropsychology, speech and language. We contribute our understanding of how a client is doing, working towards, a speech and language goal, but from a music therapy perspective, recognizing that, the speechy or the physio bring significant expertise and can set those goals and set those treatment plans. But for a certain patient, it may be that they prefer to engage and work towards those goals when music is the context through which that treatment is delivered. So we very much talk about using music as a treatment modality, and being quite clear that, for example, if we are working with a client who's got issues walking, that the active ingredient in music is rhythm. And therefore, in a sense, we're prescribing rhythm to that patient to enable them to walk better. and there's a lot of research and neuroscience around why specifically rhythm works to support the sensory motor system and get people back back up and walking in that sense. So as I said, music is multidisciplinary, and therefore our participation in the MDT is a very natural place for music therapists to sit. So that's that's really how we work there, and contributing to the shared understanding about the client or the patient. It really does depend. Certainly the research out there, and again this is borne out by clinical practice from ourselves and other music therapists around the world, not just in the UK, is that if we're working with a client and we can use music that they know, so personally relevant music, that certainly helps their engagement. Again, we may be prescribing, going back to the previous example, we may be prescribing rhythm, but I guess if we can do it within the context of a piece of music that they're aware of, maybe from pre-injury days, then we know that we're going to get, there's potential to get a really good response for them, and that's on the macro level, the whole body, and also on the sort of the neurochemical level. So in terms of dopamine and serotonin and things like that. Within music therapy practice, there is music therapy is the core profession. And then there's a sort of an advanced clinical specialism called neurologic music therapy, which has been developed over the last 20 years, initially from America, but it's now a worldwide clinical specialism. And something that Chroma and our music therapists have invested in terms of that extra training. Neurologic music therapy is specifically for people with a range of brain injuries. Could be, a brain injury caused at birth through lack of oxygen. It clearly could be for stroke, Parkinson's, the degenerative conditions, or, a traumatic brain injury in terms of a car crash or a fall or something like that. I think with each case, we are very aware that there might be significant psychological issues that may need to be dealt with. So I'm thinking if somebody has had a life-changing injury, there is really that sense of grief, of the loss of their previous self. The sort of question, why me? Why did that happen to me? We get a lot of referrals from the medical legal side of what we do, where a client may have been in various rehabilitation settings for many, many years. I was talking to a case manager yesterday about a potential client for us where he has daily physiotherapy, and he's had that for 10 years. Now, at some point, he has really disengaged with that. And I don't want to say, well, that's very understandable. If I was having physiotherapy every single day for 10 years, I'm sure I would have had enough of it. What we're trying to do in that particular case is work very, very closely with the physio to understand what they're doing for this particular client. And again, reframe the physio within a musical context. So the client starts to feel, actually, this is something that I enjoy, that I can participate in. It's different to physio, but from our point of view, we know that we are working towards those physio goals. And what we want to see, and this happens, very often in our sessions, is that the client engages for a greater length of time in a session. And again, thinking about, the dose, the frequency of the dose, we all know that if you take antibiotics and you stop halfway through, you're not going to get better. So what we're trying to do, and this has clearly a cost implication, is make sure that when we're asked to come in and do a piece of work, music helps that client engage, and therefore they can work with us throughout the course of the period of treatment we've been asked to come in on. So we're thinking about the psychological side of things. How are they dealing with who they are now? And then for For very many cases, there may be a significant cognitive, executive function sort of impact of a brain injury. It could be fatigue. It could be a much slower processing time. There clearly may be, memory issues in terms of working memory, forgetting how to make a cup of tea, the various sort of sequences and actions that you have to go through. So again, in that particular situation, we would actually, the active ingredient of music would be melody. And again, using a melody that the client already has in their memory, something that they learnt in childhood, something that they may link to a positive time in their lives, a holiday or a marriage, those sort of things. If we can use those melodies and use the melody to enable the sequence of steps to make this cup of tea. The melody is the scaffolding, so we're then hanging over that melody, that scaffolding, the new information about the sequence that we need to go to make the drink or make the cup of tea. And then eventually we take away the melody, and what the client is left with is that sequence that has been restored in a different part of the brain, hence why they can sing the tune and remember the steps. So it is very, very bespoke. Music allows us to be very, very person-centered in the way that we approach every client. And as I say, music enables their engagement, which I think is key in any course of treatment. I think we're very sensitive to music therapy, neurologic music therapy, as well as the other interventions that we provide, art psychotherapy and drama therapy. We are very sensitive to the fact that these are collaborations. We are collaborating with other professionals and family members. This is not, it's not about us coming in and saying, oh, we're better than anyone else. It's a huge collaboration. I think in terms of trying to enable the whole team around that client or that patient to feel confident about using music therapeutically through the day, that's something that we're always very keen to share. I think there is a significant, there can be a significant misunderstanding that in some ways, music is all around us. It's on the car radio. If you go shopping, it's in the shops. If you're in a lift, sometimes there's music in the lift, and there is that sense, oh yeah, music is always good. But we know that that's not the case. Music in the past and currently can be used for very bad outcomes, bad means. Troops go off to war. People get tortured by very, very loud music. So I think we are really clear that we have to be very aware about music's immense power, especially around the emotions. It can cause sad emotions, upsetting memories to come back. And therefore, when we start to work with a patient, we do try to do that sort of musical case history. So, what pieces of music do they associate with pleasant memories, happy times, and therefore, coming back to your question around it being a really, really personalized approach, again, we're trying to, I guess, start to integrate and connect up the person before the injury with the person that they are now. And music can be that bridge that starts to bring these two sides of a person together. And we want to avoid, them sort of splitting off that pre-injury self and thinking, well, life was all good, and then this awful thing happened to me, and now, it's all gone wrong forever. I think there's a huge amount of work around the mental health of some of our clients, and their psychological well-being, and again, music, either listening to music, using rhythm from a specific piece of music from their past, maybe using songwriting as a very structured approach to start to explore how they feel about certain aspects of their life, what they think is important to them. Those can all be very, very you know, important, very, very personal ways of working. And I think for all of us, you know, when we listen to a piece of music that really connects with us on the inside, it is very, very personal experience. And it comes back to what you're saying. You know, our clients do develop, as our therapists do develop, you know, very close working relationships with the people that we're there to support, and with the wider team as well, because of how music connects us as human beings, as well as connecting us on a you know, on a therapeutic level in terms of the MDT and the case that we're asked to work on. Most instruments will vibrate, and I'm thinking of a you know, a drum, a guitar, a harp, all of these instruments. If you you know, put your fingers on them and then they're played for you, or you play them, there will be vibrations that are coming off them. So I think we do have clients where hearing loss or hearing damage is an issue. Certainly sensitivity to certain sounds can be a huge issue. So either due to volume or pitch, you know, setting off anxiety, in some cases setting off you know, a series of reactions that can develop into behaviours that can challenge and can obviously be deeply distressing for the person involved. So I think that's part of the risk assessment that music therapists undertake before they start the work, is meeting with the treating team, meeting with the neuropsychologist, meeting with family members, just trying to understand where this particular person comes from musically. You know, what did they like, what didn't they like, and then if there are any specific issues related to the injury, so you know, around pitch, around volume, that we really need to be very, very sensitive to. Again, you know, we can work very much on a physiological level. So if there are episodes in that client's day where there is heightened anxiety, what we might see is that their breathing rate goes up. So, you know, lots of sort of chest movements or the in and out of the chest, and you get that sense they're breathing quickly, their heart is racing. And in those situations, if we're with them, then we would start to treat them with music that is slower, that has lots of long notes. It may be classical music. It may be sort of, I'm thinking of maybe Irish music or music that has a very sort of soft lilt to it. Again, as a way of trying to use the rhythm and the vibe of the music just to influence how they're breathing. So what we have found, and research bears this out certainly, is that music that is slower, that contains lots of long notes, impacts the breathing and the heart rate and the variability of the heart rate, and can slow that down. So again, that's sort of information that we can share with the MDT. So potentially, you know, if a client who's been catastrophically injured always gets anxious, for example, around personal care, you know, you can imagine an adult, you know, sort of everyday successful, has an awful, you know, accident, and then is completely reliant on others for personal care. That must be very, very difficult. And if that is the situation, and they do show heightened anxiety and as I say, heart rate and breathing is going through the roof during those personal care episodes, then we can help work with that staff team to say, look, from the music therapy sessions, what we can see is that this client's breathing slows and their heart rate reduces with this particular piece of music. So why don't we frame personal care with this piece of music? So play it to the client before we go into personal care. Play it as personal care is happening. Try and move slowly. Everything is reframed and sort of held within the context of music that is almost shaping what the emotional experience for that client could be. and that can be profoundly beneficial for the person themselves, but clearly the staff team also can benefit from that, because they're working in difficult situations, doing very intimate, personal care type jobs. People with a range of injuries, not just people who are catastrophically injured, but music, art, drama can offer very rich very rich environment for meaningful interactions. Whether we're working with children, whether we're working with adults, using creativity to connect with each other, regardless of if it's sort of formal therapy. We know that using the arts together as a family can be relaxing, stimulating, satisfying. Certainly, if the young child in the family has had an issue, lack of oxygen at birth, for example, and has gone on to have a diagnosis of cerebral palsy, that might leave them really with very, very significant injuries. But again, through the use of music, there can be musical conversations that the child may not now be able to talk or communicate verbally, but certainly parents, siblings, can communicate and have in my experience, what can be a very valid and very meaningful musical conversation where things do get communicated. It's not with words, but we know that music has the power to communicate way beyond what we can say, which is often why, when we're upset in our own personal lives, you can't really say, what we're upset about, but you put a piece of music on and it just connects and you burst out crying. It's like, oh my God, that music expresses it for me. So I think in those sorts of circumstances where the disability or the impact of the injury is really severe, I think music plays a huge enabling role with family members. And, in other situations where someone, may have much less severe injuries, and some of the rehabilitation may be to develop fine motor control, thinking about clients where, one of the goals has been to be able to text on a mobile phone or use, use a TV remote. We would use a thumb piano, which is called an mbira. And it's essentially a piano that you sort of hold like that, and it's got little metal tines, and you play it like that. It creates a wonderful sound. And if we're providing, 3 or 4 of those instruments to family members and saying, look, as part of your ongoing daily, daily family life, get these instruments out at meal times and just all of you play together. Again, that's creating that sense of bonding, attunement, connection. But for the injured person who's trying to develop their ability to, press a remote or text, what they're doing is all that exactly, the fine motor control that they need, that's then going to be transplanted from the musical instrument onto the mobile phone or onto the TV remote. And in that sense, it's the family who are very much working alongside us to try and build back, the injured person's sense of independence, their sense of agency. We all like the ability to change the channel on the TV, being in contact with loved ones through text messages and phone calls. It's part of what we think is, basic human life. So again, if we can support family members to do as much as they can, both towards the formal rehab aims that are spelled out, in the rehabilitation code or through instruction through case managers and things like that, as well as creating opportunities to connect through music, so much the better. It is, as we know, music is a huge connective activity, both in the brain and between people. There are huge areas of expertise around the world in terms of research universities. Melbourne University, Anglia Ruskin, many of the Lesley University, many of these places around the world. For the use, for example, just to pluck a few areas out of the air, the use of rhythm to support people with Parkinson's around gait. That is a very, very strong area of research. That specifically links to neurologic music therapy. There are various interventions from that clinical specialism, specifically around gait, balance and falls. Within stroke, again, the use of rhythm for motion, upper limb, lower limb, that's very, very strong. There was a Cochrane review, I think it was 2017, that was looking at music therapy with acquired brain injury. And off the top of my head, I think rhythm was one of the areas that came up as, you know, very good evidence base in the research. There are other work around songwriting and its impact on the psychological side of things. There is a huge and a growing body of evidence around music therapy for very young babies, so babies in NICU, neonatal intensive care units. Again, using music to connect with parents and caregivers, but also physiologically around the baby's development. There's been an awful lot of work around music and adults with learning difficulties. So I think music therapy is definitely the most developed of the three arts therapies in terms of the research. There's tons of stuff around its high levels of efficacy with patients with dementia. There are some at the moment that there's a huge international research collaboration going on between, I think it's about 7 international universities looking at music therapy and dementia. Autism has been another area that has been hugely studied, and music therapy is one of the go-to interventions for certain aspects of working with a client with autism. So it's, I think sometimes people hear the word music and then they stop, and we really need to get them through that into the word therapy, and then have a conversation with them about, you know, what can be done therapeutically when music is used as a treatment modality. You know, that's the key message that in my role here at Chroma, I'm always trying to, you know, to deliver that. You know, we are members of the Allied Healthcare Professions Group. We are regulated by the Health and Care Professions Council, and we have this enormous body of research and huge amounts of clinical practice around many areas, not all areas, but many areas. And certainly neuro rehabilitation is one of the strongest areas because of this clinical specialism, neurologic music therapy, that's had 20 years of a very, very detailed high level research looking at it. So, you know, say Parkinson's, stroke, are key areas of good research, as well as you know, the more acquired and traumatic brain injury sort of presentations. That's part of my role at Chroma, and really Chroma is here as an organisation that wants quality therapy at scale. You know, it's easy to do quality therapy. You find one really great therapist and you've done the quality. And it's also really easy to do scale, because you just take on, you know, hundreds and hundreds of therapists and you don't worry about the quality of their work. But what we really want to do is the middle ground, so quality and scale, and that's what keeps us going. And I think there is an ongoing need for education. To case managers, to solicitors, to the NHS massively. I mean, I think the NHS could, you know, spend some money on the arts therapies. That used to be that the NHS was one of the biggest employers of arts therapists in the country, and you know, with the various cutbacks, those jobs have gone. I think there are huge untapped resources and potential within the wider arts therapies professions, but that does take significant amounts of education, literally, you know, face-to-face conversations, Zoom webinars, So when we're talking to case managers and solicitors and legal teams, we obviously do flag up specific pieces of research that are linked to the presentation of the client that we're discussing. So wanting to put their minds at rest that, you know, this is an approach that is backed by evidence. I think that there is also a sense that, you know, Chroma has been around for 7 years, 7 years in October actually. So, you know, we have started to develop that reputation as a trusted provider. And therefore, once people have got over that initial, you know, anxieties with any new thing of, oh, okay, I will try music therapy for the first time on this case. Most of the time, the results are really fantastic, and therefore, it sort of it says enough to them that the client engages, that we're moving speedily towards the outcomes, and then we can support that with, as I say, webinars, sharing the research, talking people through, and just being here to answer people's questions and to you know, start to deal with some of the common preconceptions. You know, music therapy, oh, it's just for calming and relaxation, or it's just something that you listen to. It can be those things, but, you know, in my experience as being a music therapist for the last 18 years, it's much, much wider and much, much more bespoke for the individual patient. One of the main systemic issues, and this is something that the British Association of Music Therapists is very strong on and is really trying to influence on a policy level, has been the massive cutbacks, the killing off essentially of music in schools, music lessons, you know, the use of music, so singing in assembly, having music through the day. That has had a huge effect over many, many years as that, you know, side of school life has been systemically, you know, and systematically eked away and cut back. You know, other things have come in its place, very valid subjects, English, maths, science, all those sort of things. But I think the destruction of music within the school curriculum and with the education system, you know, is having a huge long-term impact on people connecting with music, as I did at a very early stage in their lives, and both, you know, developing a love of music for personal well-being, that you know, you don't have to go anywhere near a therapist to use music for your own well-being. We all do it. But I think if people aren't exposed and sort of brought into music education at some early stage in their lives, then the likelihood is that it probably won't happen later on in a way that may lead them to consider music therapy as a profession. I think one of the things that has happened over the last couple of years is that the arts therapies, so music, art and drama therapy, have now got their own apprenticeship scheme. So it's literally sort of gone live in the past few months. So what we're hoping around that, and Chroma were one of the 10 organisations who were involved in the Trailblazer group that started to put that together with some of the training universities. What we're hoping is that a much more diverse range of candidates applying to be music therapists and art therapists and drama therapists will come in, because essentially, you know, ourselves and other music therapy employers can take them on as members of our team, and then just like any other apprenticeship, we release them to the university to do their training. So I think, you know, again, that's a 5 to 10 year project in terms of seeing the results of that apprenticeship pathway. You know, within ourselves, we have about 65 to 70 therapists around the country, and you know, we've been at that level now for 3 or 4 years. We've never wanted just to have hundreds of people just for the sake of it. But we're always very, very happy when newly qualified therapists and more experienced therapists, you know, contact us wanting to work alongside us, to work with us, because there is a growing, growing recognition of the power of the arts therapies, especially around, COVID. Lots of people have returned to music and creativity generally within their families, as a way of, connecting over Zoom, connecting with people, in the single household, and also as a way of dealing with the isolation of lockdown and everything. So there's been quite a lot of sensitivity in the professional bodies about how we can start to provide COVID specific interventions that can really, again, access the power of the arts for mental health and well-being in a much more general way. And I think that is part of what we as a group of professionals are here to do. I would be absolutely delighted if, Boris Johnson and the Education Secretary really saw the value, the significant social value, and the healthcare value of having music in the education curriculum. I mean, I think it's almost criminal to strip it out in the way that it has been stripped out by, Labour and Conservative. It's not just a single party political issue. And I think it absolutely needs to go back in as a matter of, national urgency. We obviously, when lockdown happened, all of our face-to-face work stopped. And then we went into a very, very collaborative process with all the other major music therapy organisations in the UK, the professional bodies, Northrop Robbins, Chiltern Music Therapy, a lot of the NHS services. We all came together. It was the first time really that's happened. And we met every single week for about 17 weeks. And we now meet once a fortnight. And that group of 10 to 15 organisations and, the main leaders of music therapy in the UK really did significant work together as a group of professionals, supporting many, many music therapists around the UK and therefore many, many clients, thinking about how can we work online, how do we deal with, obviously, working with face masks. If you're doing some work, along a speech and language pathway, for instance, we work at Charing Cross Hospital on their acute stroke unit. So a lot of our clients there do have speech and language issues, and music therapy can help to support those. But the client needs to see our face. They need to see how our mouth is moving, because that's what we're wanting them to do. So how do we do that, with a face mask on? So very, very practically and in a very granular way, we've had to think through, at that level, how can we provide input around breath control and increasing the volume of someone's voice post-brain injury, when we really are told by the government that we need to prevent aerosol, and spit and sort of, aerosol coming out of their mouths to prevent the spread of the disease. So again, it's been a very nuanced piece of work. And this amazing sort of group that has developed within the music therapy profession has also, spent a lot of time thinking about the music therapists and the art and drama therapists as well, to some extent, but how the music therapists who are self-employed or employed, how they are, dealing with the new landscape. I think that's been a huge and very, very significant coming together. As I say, I think the first time that those 15 or so large organisations around music therapy have really come together and worked so collaboratively. I think it certainly suggests that the future for music therapy on that strategic level is very, very bright, because it is it's a massive collaboration. Certainly within Chroma, about 50% of our work moved online. That was a case-by-case decision, as much for the client, the MDT and our therapist to decide whether it was appropriate to move online. And as a result of that, we're now in the development stage of putting together an online only therapeutic program for, I guess, a sort of more general, general population type sort of patient group or person group. So around, motivation, stopping smoking, some issues around stress and anxiety at work, those sort of more everyday things. We've really seen that working online is a very, very useful, very valid way of working. We're also now really starting to think about if we're wanting to support teenagers, people, millennials, people in their early 20s, where using WhatsApp, using text, that is so much part of their day-to-day life. The thought of, having to go into sort of stereotyped traditional therapy, I'll see you at 3 o'clock on Wednesday, and you have to come into my room and it'll be an hour and we'll be doing, the session. That's just like never ever going to work for a 16-year-old or an 18-year-old who just does not have that frame of reference. So we're also at Chroma, looking at ways in which we can develop very robust therapeutic interactions, but can we deliver them via WhatsApp? Can we use, text analysis software to look at themes that are coming through from text messages or those sort of chat-based ways of working? So I think COVID has really spurred on the profession, and certainly spurred on ourselves to open our minds to a whole range of other ways of working. At the same time, for us, holding on to those core clinical ethics as therapists, are we, first of all, doing no harm? And then secondly, are we supporting that person to work towards the goals and the outcomes that they feel are important? And so I think it's a really very, very interesting time to be in the arts therapies, and certainly as a music therapist, I think it's a great time to be a music therapist. That's part of where the profession is really starting to catch up. I think for years, I've written a book called The Economics of Therapy, 2017, which started to unpack the economic reality of being an arts therapist. I think for years, the sort of the economic side of the profession, how much do you charge, how much profit do you need to make to be a legitimate sort of financially stable business, all those things were a bit taboo, and also therapists generally felt quite uncomfortable thinking about the financial, the monetary aspect of what we do. Mm-hmm. So I think again that the profession is hugely catching up on itself around that, and I think we're also very much learning from other sectors. So with ourselves, again, thinking around the online program that we're trying to put together, if we look at, gym memberships, is that a useful model that we can sort of use to transplant over to our online, arts therapies offer? I don't know, we're having those conversations, but again, what we're trying to do is provide something that many people will find therapeutically helpful, and also have it at a cost that is going to be something that many people can access, because there's really no point in putting something together that only wealthy people can access. That is just it's pointless. Our goal, as I said, is quality therapy at scale. That's got to be the underpinning. We're looking at, as I say, those whole range of different pricing models and ways of doing that are quite normal in other areas of everyday life, really. But the main message is really about the use of music as a treatment modality, and using specific elements of music, rhythm, melody, pitch, as the active ingredient to treat. And the way, as I said right at the beginning when we were talking about the MDT, music is multidisciplinary. It connects across a hugely diverse range of areas in the brain. And again, there's really significant research from the whole area of neuroscience around the way in which that when the brain is stimulated by music, new neural pathways are created. So it's not necessarily about fixing, the part of the brain that got damaged in the stroke or the accident, but it's about trying to go around those areas and rewire, and rewire and reconnect areas of the brain. And I think that's, that's one of the main reasons that people should really feel really confident to use music therapy and neurologic music therapy, this sort of clinical specialism around brain injury. People should have real confidence in music therapists as a group of highly skilled professionals, working with a huge diverse range of people and clinical populations. We can do an awful lot of very, very skilled, quite difficult work at times. And people should have confidence in using us. So now the qualification that leads to the Health and Care Professions Council registration, it's a master's degree. So most people will either have done a music degree or as I did, a sort of creative arts degree. They may be musical and then have done a psychology degree or maybe a medical degree. They could just be musical and be a social worker. So there can be a whole range of backgrounds. You can obviously come to a master's without any previous university qualification. You can come in as a mature student as well. But all the training pathways for all of the arts therapies are at master's level. So normally it's a 2 to 3 year process, depending on whether you're doing that full or part time. When you finish your training and you get your license to practice from the Health and Care Professions Council, yes, you're newly qualified, but you have you've got 2 or 3 years of quite good work under your belt that you can put into effect, and that's part of, I guess, what we do at Chroma with our graduate scheme, is really trying to encourage newly qualified therapists to join us and essentially transition from being a trainee to being a working music therapist through ourselves, with all the clinical support and the management support and things like that we provide. So yeah, that's it. Go and do a master's if you want.